So in most cases, I think our clients' issues are around cost, quality, and access for their employees. They want to make sure that their employees find a setting for them to get health care in a setting that is the lowest cost, the most convenient for them to access, and the best quality. And so along those fronts, we provide on-site care for a lot of our clients that has a clinic on-site that allows their members to come on-site, usually within a 24-hour setting, to address their healthcare needs.
In the early days, it was primary care. That's really all we did. But we've grown into offering multiple ancillary services: behavioral health, physical therapy, physical medicine. MSK is always in the top 5 of the employer's spend. Nutrition counseling, health coaching. We're always looking for new ways to impact the cost and bend that cost curve.
I think the number one differentiator of our way of delivering the services we do versus our competitors is what I've seen is the competition addresses it with a single point: a director of operations who handles everything. Communications with the client, which typically is an HR person or a CFO or a benefits or a total rewards person, and also dealing with the individual members. So instead of having one person at one client managing 1 or 2 clinics, we take 3 experts in those roles: a medical leader, a client success director, and an operational leader who understands what good looks like in the clinic. Put them together and manage a book of business so they can be a consistent, constant presence with the client, helping them address all 3 of those spectrums in what they need to do to run an effective clinic.
We can provide data points that you will not receive through your insurance company or through your pharmacy benefit manager. For example, we can provide adherence data on medication. Adherence data is really important because if you go to a provider, you are likely 60% of the time to receive a prescription. However, only about 40 to 50% of the time is that prescription actually filled or taken to completion. And we also know that there is cost savings to be had through adherence. So we can provide that adherence data that a client just won't get elsewhere. We can tell our clients that, hey, with our quality data, we can tell you that if our metric for diabetes control is above the national average, and CareATC right now is running about 70% control on diabetes, compared to national data based off of HEDIS metrics, that an average local healthcare vendor has 55% control.
CareATC provides a comprehensive suite of services, but we don't have to provide all of the services for an employer. So if there's already identified vendors where they have strong partnerships, how do we foster those relationships, maximize the return for the employer, but ultimately make it easy for the employee to navigate those services? So a lot of times we become the conduit to those other offerings, and again, really helping navigate that from an employee perspective is really key.
Our clients are always looking for new, what's the next big thing that we can implement to bend the curve, and we're here to serve.